Good afternoon, everyone. Welcome to the Centre for Care seminar series. My name is Magella Kilkey. I'm going to be chairing the session today. I'm one of the co-investigators in the Centre for Care based at the University of Sheffield. So I welcome very much our speaker today, Jennifer Piscopo. Jennifer is a professor of gender and politics and director of the Gender Institute at Royal Holloway, University of London. Jennifer's research focuses on women's political representation and gender and public policy in Latin America, the United States, and more globally. She has a book coming out, maybe it's already been published since we had this bio, a book called The Woman's Right Era, 50 Years of Gender Equality, Advocacy and Reform, to be published with Polity Press. Jennifer also does a lot of work beyond academia, consulting for international organizations and national governments, including the Organization of American States, UN Women, and UN Cities and Local Government. So today, Jennifer's going to be taking us to Latin America and developments in Latin America in the area of care. The title of her presentation is Care as a Public Good and a Human Right, Latin America's Transformative Care Agenda. So Jennifer's going to speak for a maximum of 40 minutes, and then we'll have time for Q&A. If you've got a question, at the time we get to the Q&A, you can put that in the chat, or you can turn on your mic and video and ask it. But for now, I'll pass over to Jennifer. Over to you, Jennifer.
Great. Thank you so much. Thanks so much for having me. I'm so excited to see so many people online and in person. So I'm really excited to share this work with you today. I'm going to go ahead and start my slides. There they are. Okay. And I'm going to start you at the beginning, not at the end. Let's do that. So the project I'm presenting today, I've been calling it Care as a Public Good and a Human Right, Latin America's Transformative Care Agenda. And this is really a new research area that I've been developing in the past 2 years on gender and care policy in Latin America. And I've been working with Dr. Kieran Stallone, who's a fellow at Harvard, and we have been doing fieldwork in the mark of this project in our larger project that we're calling CARI, which is the Care Rights and Inclusion Project. So I'm really excited to share this work with you today. So I think the idea of care gaps will be really familiar to this audience, but just to set the scene for the care gaps in Latin America, this is data from the UN Economic Commission on Latin America, or CEPAL by its Spanish acronym, and it is the proportion of time, total time that women in purple and men in sort of greenish blue there dedicate to unpaid care work. So unsurprising, I think, to everyone in this room, we see the consistent pattern where on average in Latin America, women dedicate about 3 times more time than men to domestic work and to care work. So just like all of our regions in the world, we see these persistent gaps in who does caring work in the home. So the motivation for this project, building on those care gaps, was that actually these care gaps long have been on the agenda of Latin American activists and Latin American femocrats. So adopting that term of these feminist activists, but then move into the state. They move into social policy ministries and develop ministries and bring their feminist commitments with them. So both femocrats, the feminist term for bureaucrats, and activists have been thinking about these care gaps for a long time. And I was drawn to this really region-wide acceleration of policies in the past 5 years that were taking 2 primary tacks relative to care. First, we see the enhancement of state provisioning via countries and subunits, so provinces and cities adopting what they call universal or comprehensive care systems, and then also a region-wide acceleration of policies that are compensating unpaid carers for foregone wages. And so many Latin American countries, especially after the pandemic, started expanding non-contributory pensions, what we might call colloquially housewife pensions. So what's notable about this, for those of you that don't know, is that because Latin American countries share this political and cultural milieu, and there's a lot of regional conferences and regional networking events that facilitate exchange between Femocrats and activists, we have a lot of policy diffusion and policy learning. So policies that start in one country, Brazil adopts a housewife pension, sort of rapidly start spreading across other countries in the region. And a main avenue through which this happens is CEPAL, that UN Economic Commission for Latin America and the Caribbean, hosts a triennial conference on women, on the women's movements and women's issues. And that triennial conference will be really important for the story that I want to trace and share with you today. So in this project, my real focus, when I think about care, our focus at the CARI project is on unpaid carers. So there's obviously so many other dimensions to care. I'm happy to talk in the Q&A about parallel but also very important movements in Latin America around wage domestic workers and the rights of wage domestic workers. There's other policy conversations about sort of the quality of care within the care economy, but we're really focused on how countries are now thinking about unpaid carers. And so we are sort of taking our inspiration with the campaign that I think will be familiar to everyone around wages for housework, and this question of how does housework become economically valued by governments. And so the principle, right, for wages for housework was that if housework is work, then of course unpaid carers are workers and they have agency and they can engage in a political struggle over how care is provided and how their time and effort in unpaid care is compensated. So what I focus on in my research and what we focus on in the CARI project is not looking just at social protection and social insurance schemes that try to bolster family incomes. In the Latin American context, these social protection and social insurance schemes are usually means tested, they're anti-poverty measures, and they're designed to sort of stabilize households and facilitate consumption. So while social protection and social insurance can increase the money that comes to households and maybe help households pay for care, they're not really designed as compensatory policies for unpaid carers. And similarly, we're also not really focused on parental leave. We think about parental leave as more employment and wage protection measures for those already in the workforce. We really are thinking about what are the policies and how are the policies diffusing that respond to unpaid carers. And there is in the feminist discourse and the feminist movements, both historically and today, this transformative feminist aim related to how gender equality and how women and men's roles would change if unpaid care work were to be assigned an economic value. And so one of our questions is, do public policies around compensating and remunerating unpaid care sort of meet this feminist aim in practice? So to give you a sense of what has been happening in Latin America, one part of my research is trying to trace this emerging discourse around care. And of course, care has long been on the agenda, but it is notable in the post-pandemic movement how the regional dialogue and discourse around care has shifted. So I mentioned earlier those triennial conferences on women that are organized by CEPAL, by the UN Economic Commission on Latin America and the Caribbean. And so the 2022 conference, the main document that came out of that conference was an agreement to move towards a caring society. And so the document, the conference report, is called The Caring Society, The Horizon for Sustainable Recovery, based on gender equality. And I think it's really worth taking a look at this document at length. It's also called the Buenos Aires Commitment because the 15th CEPAL Conference on Women was held in Buenos Aires. And so I think it's worth taking a look at what this document says. And so there's a shift from thinking about care to sort of a disparate collection of social services that take place in the home or the state or society, and towards repositioning care relative to a development model that prioritizes the sustainability of the life and the planet, and that recognizes care as part of human rights that are fundamental to the well-being of the population of a whole, and ensures the rights of the people who require care or provide care, and then thinks about the multiplier effects of care on the care economy, and linking then the idea of care to pandemic recovery, and pandemic recovery with an eye to equality, but also environmental and planetary sustainability. So the pandemic and this idea of rebuilding better really infuses in Latin America, but also elsewhere, the way care starts to become talked about. So that was 2022. I can fill in the gaps later on in the Q&A, but to sort of even see where the movement goes from 2022 to the next triennial conference, which would be in 2025, right? This is the 16th conference on Latin American women in Latin America and the Caribbean, hosted by CEPAL. In Mexico in August, you get now to the Tlatelolco Commitment. And this is where the countries essentially agree on a decade of action to achieve the care society and the direct link between the care society and and substantive gender equality. Now, in parallel to the Buenos Aires Commitment of 2022, the Tlatelolco Commitment in 2025, in 2022, Argentina, um, which had made a variety of advances in public policy towards unpaid carers in the context of the pandemic, is picking up this agenda. And so in 2022, Argentina submits to the Inter-American Court of Human Rights a request for what they call a consultative opinion or an advisory opinion, which is to ask the Inter-American Court of Human Rights to weigh whether or not there is a human right to care. So Argentina initiates that process in 2022. Over 100 organizations, primarily but not exclusively from Latin America and the Caribbean, send in a Friends of the Court brief. The Inter-American Court of Human Rights then holds a public audience with the largest amount of civil society participation to date in a public audience held by the Inter-American Court of Human Rights. And then pretty much simultaneous to the Tlatelolco Commitment in 2025, the Inter-American Court of Human Rights issues its advisory opinion of 2025 that's the result of that 2022 petition. So as I mentioned, right, this comes about as the result of the 3-year consultative process, the largest ever conducted by the IACHR. And the IACHR determines that, in fact, care is an independent and standalone human right. So it's not just a human right that sustains other human rights, but it is a human right on its own. And for those of you that are interested, the decision is on the court's website, and the English translation was just released I think about a few weeks ago, so you can read the decision in full. I really encourage you to read it. But in summary, the Inter-American Court of Human Rights define care as a tripartite right. And this idea of care as a right to be cared for, to give care, and self-care doesn't emerge from the court. It's part of Argentina's original request. That was how Argentina asked the right to be framed. And it's part of the coordination on this idea of a tripartite right that all of the civil society organizations amplify in the Friends of the Court briefs that they submit over this consultative process and that they orally present during the oral hearings. So what I want to suggest is what are some of the policy implications that emerge from this discourse and this framing of care as a human right? And I put up on the right-hand side some of the cards that the Inter-American Court of Human Rights then prints and distributes to diffuse its consultative opinion. And what the dark blue banner says, caring is not a game. And then each of the blue cards sort of has a question like, did you know that there are places that will help you care? Do you know that care is a task that begins in the family? So the implication here is care is a human right. There's a move towards a caring society. It's being framed as contributing to the agenda for gender equality because a caring society will eliminate gender gaps in care provisioning, and that care has economic value because it contributes to human and planetary well-being. But one of the things that I've really noticed sort of working my way through these documents is there's obviously a clear sense that care matters for gender equality and that care matters for women's ability to seek employment, to have greater self-determination, have greater agency over their lives. but there's not an explicit framing around human rights. There's an explicit framing, excuse me, there's not an explicit framing around women's rights. There's an explicit framing around human rights and gender equality and attaining gender equality, but not necessarily around human rights, women's rights. Good heavens, maybe that's something we can talk about in the Q&A. And just to show you what the back of these cards looks like, so I said each of these cards has a question, and then if you flip it over, you get the answer. So this is the answer to the question, did you know care isn't just the work of women? And you flip it over and it says, to accompany, to decide, to prepare food are all tasks that contribute to caring, and those who care need recognition and rest. So again, you can see these public agencies really engaging in this long-standing feminist discourse around the 3 R's or the 5 R's of care. Okay, so that's a bit of the narrative framework that feminists have been working on and that feminists have achieved in some of these documents and more recently in the IACHR decision. And so then the question is, what are Latin American countries actually doing around unpaid care? So as I mentioned at the very beginning, there's a rise of these non-contributory pensions in the region. We could call them housewife pensions. So these are cases where when unpaid carers, primarily women, have exited the labor force or have never been in the labor force, the state is making pension contributions on their behalf, depending on the number of children and or the number of years outside of the workforce. There's also a huge region-wide push to adopt these national care systems. They're also sometimes called universal care systems, comprehensive care systems, and you can see here an image, the Organization of American States actually in 2022 or 2023, I think 2022, released what they call their model law for care systems, which is essentially guidance legislation for the Spanish and Portuguese speaking countries of the region if they want to have their own national care system. So national care systems, were first adopted by Uruguay in 2015. So Uruguay positioned here at a bit of the head of the curve relative to these discourses of a caring society. The idea is that national care systems integrate care for dependent adults, children, and people with disabilities rather than sectioning the care across different sectors. And it's supposed to bring all the state's care services and all the state's care provision into one umbrella. So when national care systems are being debated, it's actually not just carers that are involved in these conversations. It's various rights groups, it's various public health groups, but they are almost every Latin American country at this point has either adopted a national care system, Venezuela, Colombia, or Chile, or has one pending in the sense that it's in Congress right now. As I mentioned, these are complex omnibus bills. They have multi-stakeholder coalitions. And there are also a lot of provincial or municipal governments that are trying to adopt their own comprehensive care systems. But turning to my focus on unpaid carers, it's notable that actually only the care systems in Mexico and Chile are really contemplating services or opportunities for unpaid carers. Most of these national care systems are thinking about providing care to those who need care, not providing care to those who have been giving care all along. So that brings me to what I want to talk about for the remainder of the presentation is the model that was developed in Bogotá and is now being picked up in some other places around particularly thinking about unpaid carers and where unpaid carers would sit in care policy generally and in the development of universal or comprehensive care systems specifically. So this is Bogotá's idea of what they call in Spanish the manzanas del cuidado, which we would translate in English to blocks of care, or sometimes in the UK context where the idea of a city block, which is a very American term, we would say a street of care. But manzana has a dual meaning in Spanish. It can either mean the fruit and apple, which is why you see this very nice kind of apple-like logo, or it can mean sort of a city block, which would be sort of then the idea of the block is it's sort of your neighborhood, or it's what you have in the immediate vicinity of your house. So Bogotá, in the pandemic context in 2020, adopted a municipal-wide care system, but its signature program within that care system was what they called the Manzanas del Cuidado, or the blocks of care. And these were community centers that were specifically designed for unpaid carers. Their goal was to offer respite, recreation, and income generation activities to unpaid carers in order to return to unpaid carers their foregone time and opportunities that had been turned over to care in the home. So this little picture of the leaflet here says the blocks of care are a reality in Bogotá. We have attended to more than 345,000 women and helped more than 345,000 women carers and their family. So I had been hearing about these blocks of care as I started to work on this care project. And like many, there's been a lot of international attention to the blocks of care. Some of you might have heard of them. Like many, I was really interested. And I also thought, are they as good as they say they are, right? I've been doing policy research in Latin America for a long time, and we all know, not just in Latin America, but often the gap between how a policy is presented on paper and what it looks like in reality is really quite large. And one of the questions around the blocks of care was, well, what really happens when women go there, right? Are these really maintaining this feminist ethos of trying to, support unpaid carers and transform the work of unpaid care? Or are they simply trying to, take the edge off unpaid caring duties and make it easier for women to fulfill their duties in their home, right? This long-standing theoretical tension on care policy, is it really feminist or is it really feminizing? Is it locking women into unpaid care by just making it a little more bearable, or is it trying to transform the conditions under which unpaid care is carried out? So this is where Dr. Kieran Stallone and I developed the CARI project. And so our first plank in the CARI project was to actually go to Bogotá. So we did field work in Bogotá in April 2025. We visited 5 of the now 25 manzanas. So we had a really good sample of the manzanas. As I said, they were first opened in 2020. There's now 25 of them across the city of Bogotá. And I should also add that Bogotá is a megacity. I mean, it is absolutely enormous. It is about the size of many small countries. So one of the things we're really thinking about is if it can be successful in Bogotá, given Bogotá's size, it could be successful elsewhere. So we visit 5 of the 25 manzanas now operating across Bogotá. In these 5 manzanas, we interview 29 staff members. We conduct focus groups with women users. So we have 25 women that participate in focus groups in total. And we interview the policymakers that were either involved in the manzanas original design and launch in 2020 or are still overseeing them now. So we really do very comprehensive field work. And what you see here is a picture of my co-investigator, Kieran, and she's talking to the coordinator, that would be the director of the manzana, in a location in Bogotá known as Martires. Martires is one of the most marginal neighborhoods in Bogotá. It is known as the red light district. It is the home to many sex workers. It's the home to many migrants, both Venezuelan migrants who are migrating because of the crisis in Venezuela, often arriving without documentation, but also many internally displaced people from Colombia's civil war. Many homeless and itinerant individuals also live in Martires. And what is really fascinating about the manzana in Martires is it is housed in a former strip club. And you can see that Kieran and the coordinator there are standing under a menu. That is the menu of the bar that used to be at the strip club. So this is a repurposed community space that they have transformed into the manzana, and it really takes a building that has quite a sordid history in that neighborhood and repurposes it into something quite remarkable and quite positive. So the first thing that blew us away about the manzanas, which we translate into public policy speak by saying the manzanas turn out to be cost effective and locally responsive, is that none of the 25 manzanas are the same. So when the policymakers who were elites in the women's secretariat in the city of Bogotá, set out to design the universal care system and design the manzanas del cuidado, the first thing they said was they didn't want to have to build new spaces. They wanted to look for existing physical spaces in neighborhoods that were underutilized, but that had a particular kind of importance to the community. So they transformed unused existing physical spaces, but they were physical spaces that did have already some kind of ownership. So if we go back, for instance, to this former strip club in Martires, it housed a non-governmental organization that was a community arts organization. So when it ceased to be a strip club, it was taken over by a non-governmental community arts organization. So the designers and the Women's Secretariat looked for spaces, institutions or organizations that had spaces that were underutilized, and they said, we want to transform that space into a manzana del cuidado. And they then call the original owner of that space, so in Martires, the non-governmental organization, that's the arts organization, they call that the institutional anchor. So each manzana is co-located with an existing organization or institution in the city. It shares that physical space, so it has a home, and that this idea then embeds the manzana into the community and into the needs of the community. Part of the other principle that was really important to the designers was this idea of 15-minute cities. So they wanted the manzanas to be in buildings or spaces that were already being visited, because they wanted them to already be on the route of the unpaid carers in that community to make them easy to visit. So in Martires, we get a manzana del cuidado opening in a former strip club, now run by a community arts organization. In the photo you see here, which is Manitas, which is a very marginal urban area high in the mountains outside of Bogotá. You can even see the cable car up there. You get the manzana opening in an existing municipal building. And in the bottom picture, in the neighborhood of Engativá El Pueblo, the manzana opens in a community health center. So this institutional anchor system creates a variance across the manzanas, and then it also creates a variance in what the manzanas offer. So for instance, in Martires, because this is a dense, highly urban neighborhood with an itinerant population, the recreation classes they open are all indoors. There's no space for outdoor recreation or a bicycle school, but you go to the mountains in Manitas and they're able to transform the roof of the building into a school to teach unpaid carers to ride bicycles. You go to the sort of semi-urban neighborhood of Engativá El Pueblo. It's a health center with a nice big backyard, so they put an urban garden in the back. So each of the manzanas starts to develop their own character. And the way that they do it is they look at the other city agencies or non-governmental organizations that are based around the manzana that are already perhaps offering services, and they sort of channel those services into the manzana. However, the Women's Secretariat in the city of Bogotá does want there to be some uniformity, right? So what the Women's Secretariat develops is a core offering across the manzanas that provides a common thread. So you have a core offering by the Women's Secretariat across the 25 manzanas, and then you have a lot of local community-based variation depending on where they're sited and depending on what the needs are. And all of this is then sustained by an interinstitutional agreement where all the institutional anchors, all the contributing organizations, all the contributing city services basically sign a pact for how every manzana is going to run. And this also then helps share and diffuse the costs. So what is the feminist core that the Women's Secretariat ensures that's offered at each manzana? So the Women's Secretariat offers 2 signature courses that they give to all of the unpaid carers. And I should say they are open to unpaid carers of all genders, but most of the users are women. So the 2 signature courses are sort of programs that the unpaid carers can come in, they sit down, there's an instructor. They're called The Value of Care and Women Who Care and Women Who Lead. And in our fieldwork, Kieran and I actually had the opportunity to observe some of these courses. And, the unpaid carers are doing body mapping and trust falls and all kinds of dialogue and activities, but the content of the courses is all about gender neutral language, the history of women's rights, how they have a right to demand co-responsibility in the home, how they have a right to ask that members of their family share their care duties. I mean, we were actually sort of taken aback by the sort of high level, even theoretical feminist content of the courses. And you can see here on the picture that takes up the whole slide, this is artwork from one of the activities that was taking place in the manzanas when we visited, and the women are writing out women's rights on post-it notes and putting them up on the board. And so these say things like political rights, right to the autonomy over my own body, right to a life of violence, right to work, etc. In addition to the courses, the manzanas also offer what they call a psychojuridic dupla. So that is every manzana has a psychologist and a lawyer who work in a pair that provide free psychological and legal counseling. And they help unpaid carers, primarily women, initiate any requests or even court processes through the state. So anything from collecting money from childcare when it's owed by an ex-spouse, to opening a process to file a complaint of elder abuse or domestic abuse, that's provided free of charge. And all of the manzanas also offer a child minding service that's called el arte de cuidarte, which translates to the art of caring for yourself. And the child minding service is also often staffed by a dupla, meaning there's a pedagogy expert and an art therapist who are minding the children. What's really fascinating about this child minding service is it's not childcare. It is not a child care service that children in the community can enroll in and attend full time. It is actually only available to unpaid carers to leave their charges while they're attending an activity in the manzana. So even the child care is designed to facilitate the unpaid carer's participation in an activity in the manzana. It's not designed as a standalone, child care offering. And then some of the results from our focus groups with the women users, we heard time and time and again from the focus groups without us prompting that the biggest thing they had learned by attending the courses, the yoga classes, the aerobics classes, the digital literacy classes at the manzana, whatever they were attending, they told us over and over again, I learned to care for myself. So we heard comments from the women users that before the manzana, they had never done anything for themselves. And now after coming to the manzana, they were doing things for themselves. Many of the manzanas offer sort of entrepreneurship courses. They train women in how to open small businesses. Again, we were really skeptical. And then we sat in on one of the courses, and this was not a kind of light, patronizing content. The instructors were going in and they were telling the women how to set up a social media account, how to buy their permits, from the city of Bogotá to be able to sell in fairs. One of the women we talked to said, I never knew until I did this course that I should price my own time when setting the price of my product. So the women are really getting, very, very serious instruction at these manzanas. You can see there's a picture of my co-investigator, Kieran, with one of the women we met. The women are participating in physical education activities. This woman here told us she had never exercised before, and then she comes to the manzana, she starts doing yoga, she starts doing aerobics, and then she runs a 5K to raise awareness for femicide. And on the very right panel, this is from a photo from Martires, which is the former strip club. And this is a really neat and interesting way of the way the manzanas are building on and channeling existing city services. So in this red light, heavily immigrant district, there's already a program from an NGO that is training immigrant women in how to get their degree in cosmetology. So the day we visited, some of the women users in the manzanas are receiving manicures. So they're getting cared for, but they're getting cared for by the women enrolled in this job training course with this NGO. And so those women are then getting the hours they need for their certificate, by providing the services in the manzanas. So we were pretty blown away in our fieldwork. Kieran and I walked away pretty convinced that the Women's Secretariat in Bogotá had developed a really clever, creative, cost-effective model for attending to unpaid carers and thinking really about transforming the three R's or the five R's into reality, that women feel that their unpaid care work is being recognized, it's being rewarded, and they're learning how to redistribute it. So things we're working on now, we're trying to put together the Bogota experience, suggest it demonstrates that public policies focused on unpaid carers can advance the caring society, they can be feminist, and that they actually can be cost effective. And we are looking now at some of the ways that the Bogota model has diffused to other contexts. So I have some here, these photos of Mexico City's utopias, which are their answers to the manzanas, which are these similar kinds of caring centers. One of them is designed as a boat, and we're very excited. In about 3 weeks, we're going to be going to Mexico City to visit some of the utopias. And I think one of the questions we do have as we look at these discourses, as we look at this policy diffusion, is, how right-wing actors might try to start appropriating the feminist discourse and the feminist initiative for their own ends. Maybe that's something we can talk about in the Q&A. But thank you so much. This is the results of our visit to Bogota, and I put a QR code up if you'd like to scan and download our brief. We would be super happy to have you read it. And I really look forward to your questions. Thank you. I'll just leave that up. Okay. I can share that again at the end.
That was fantastic, Jennifer. Thank you very much. Such an inspiring example and set of examples.